Good afternoon, everybody. Doug McGowen with the City of Memphis and representing the Memphis and Shelby County Joint Task Force. Joined today by the Director of the Health Department, Dr. Taylor, who will follow me. Today I'm going to cover just a few things, the status of our hospitals. I'll talk a bit about testing, and then I'll give an update on vaccines. Many of you have seen articles in the press, and I cannot say it more plainly, but our hospital systems are in crisis due to the volume of patients that are coming to our emergency departments. And that was made very clear when the collective body of our emergency department medical directors sent a letter to all of the area mayors, the health department, and expressed their dire concerns for the situation that we are in. And I'm just going to read a few excerpts from this letter. It is posted to the city's website. I'm sure it's on the shelby.community website as well, or will be soon. And for members of the press who would like it, we're happy to provide a copy. But from the medical directors, currently our system emergency departments are operating dangerously over capacity and housing dozens of admitted patients in each of our emergency departments. Projections for COVID patients that are hospitalized patients will double by the end of this month and increase sixfold by the end of September. That increase would produce more admitted COVID patients than the city has hospital beds on any normal day. Now that's greater than the capacity that we would have and does not account for non-COVID emergencies like stroke, heart attack, and trauma. They have informed us that they may have to begin triaging care to patients in just the next few days. And to be clear, that means they may be unable to provide timely care to everyone and have to make choices about delivering the care to patients based on their probability of survival. Now, there's more to that letter, but that is stark, and it shows us that the crisis is here as a result of a high patient census already, in the impacts of COVID hospitalizations, which are nearly 10 times as high as they were just 60 days ago. So what can you do? First, keeping people from unnecessarily traveling to the emergency department so that we can preserve resources for people who desperately need that care. So I would ask everybody to take this as a personal challenge. I know firsthand that when you're not feeling so well, you want to delay that visit to the doctor and write something off. I would encourage you to take action swiftly, and I would encourage you to go to your primary care physician or an urgent care or an ortho clinic during their normal working hours to have your issue addressed. I know as a father that typically when you watch your kids during the day, by the time they are really sick, it's usually in the middle of the evening or late at night, and now you have very few other options besides a trip to the emergency department. A proactive trip to your doctor, a proactive trip to the urgent care during normal business hours will really help us from having people stack up at the ED. I will ask you not to go to the emergency department just to get a COVID-19 test. We have lots of places where you can get a test. COVID19.memphistn.gov or shelby.community. Lots of places where you can get a test. And then obviously doing the right thing, wearing your mask, complying with the recent health order that goes into effect very soon, and doing the right things to prevent exposing yourself or others to COVID-19. We all have to do our part to make sure that we don't unnecessarily burden our already overburdened emergency departments. I'll move on to testing. There has been an increased demand for testing. Just several weeks ago, we were doing at one of our locations 25 to 40 tests per day. That increased to 250 tests per day. At another location, they were doing 100 to 200 tests per day, and that's ramped up to almost 700. The demand for testing is because people are trying to find out their status, and we also know that people, as the terms of their employment, sometimes have to get tested to continue their employment. Because of that, our team in the public sector is expanding access to testing. We have sites like the Lamar Avenue Testing, former Vehicle Inspection Center on RKS Commercial Cove. We are expanding capacity at that site. Christ Community is one of our community partners. They are looking to see what they can do to expand capacity in partnership with the Shelby County Health Department. Poplar Healthcare out on Hacks Cross is looking to open another lane and add some capacity there. So I will ask you to go to COVID-19.memphistn.gov or shelby.community to look for a place where you can get tested, both public and private sector, and just know that we will add some capacity in response to the demand that we are seeing. Now, getting people vaccinated is something that is very important, and you all know that. We have had a phone bank that has made nearly 45,000 phone calls. Just this week, we called 8,800 individuals and encouraged them to get out, to get vaccinated, to help them over their vaccine hesitancy. That has been complemented by our door-to-door campaign that has been going on for more than a month, and our Vaccine on Demand program that's been going on for several weeks. We had focused our efforts in North Memphis and Fraser. We have knocked on 5,000 doors in that area, and we have had 100 people take advantage of vaccines on demand. Overall, in Memphis and Shelby County, we have delivered more than 800,000 vaccines, actually 803,430 vaccines, 803,430. That means 48% of our population has been vaccinated. That's more than 450,000 people, and 356,000 people are fully vaccinated. That's 38% of our population. We encourage everybody to help us get those numbers moving up. We have seen some uptake in vaccines recently, and we encourage everybody to get out and get that first dose and second dose. That leads me to your logical question, well, what about a third dose for both Pfizer and Moderna? That's the boosters that you may have heard about. Well, we are preparing for the eventuality of boosters for everyone when we are given that direction from the state. As you know, recently there was an announcement with people with underlying conditions can get a third shot of Pfizer or Moderna. We expect that the middle of September, there will be authority to provide a booster shot to other individuals who don't have underlying conditions, and we've been talking to the state about our strategy. I have told you at this venue before that we would be closing down the Pipkin at the end of August. Clearly that is not going to be something we're going to want to do based on what we believe to be a significant increase in demand for both first and second doses when the FDA approval comes, and a pretty significant demand for that third shot, which is shown to improve your overall immunity from the disease. So I am pleased to announce that our partners in Germantown and Collierville have agreed to open another high-volume vaccine site. More details will follow on that. It's not open today, but you'll be able to find out when those sites are open if you go to covid19.memphistn.gov. As we formulate the plan and as we move into September, we will provide more details about expanded days, expanded hours of operation, and where you might be able to take advantage of those booster shots. So stand by for details. Know that we are actively working to make sure that you have the opportunity to get a booster should you need it and when we have authority to offer it to you. So with that, I'll stop and I'll turn it over to Dr. Taylor from the Shelby County Health Department.
Good afternoon. I'm here to present the COVID picture for Shelby County for today. Total cases to date, 116,834. New cases reported as of August 18th, 915. For context, the highest number of cases reported so far in Shelby County during this pandemic was on December 16th, 2020 at 1,163. The 7-day average of cases per day currently as of August 18th is 687. And currently, the active cases in the county, meaning folks who have been tested in the last 14 days, is 7,701. Total vaccine breakthrough cases identified to date, 1,353. And total deaths in the county, 1,785. 7-day average of vaccinations per day, 1,495. And Chief McGowen has already gone over this, but the proportion of population with at least one dose is 47.6%. The proportion of population fully vaccinated is 37.6%, and the proportion of eligible population, meaning that they are 12 years of age and up, is 45.2%. Now we're going to go through a few slides, and I think you've already been seeing some of them, but I want to go back through them. The first is a curve showing not only all of the COVID cases in Shelby County represented in blue, but represented in orange are the cases among the pediatric population. So currently, we have a total of 7,701 total active cases, and we have 2,022 pediatric active cases. On the next slide, you will see the 7-day rolling average of our test positivity rate. It is 21.4%, meaning that of all the COVID tests that have been done in the county, the rate of positives is 21.4%. On the next slide, you'll see hospitalization utilization rates, meaning that these are the numbers of people who are currently admitted to the hospital. Each bar represents a day of admission rates. As of August 18th, 646 individuals have been hospitalized in Shelby County for COVID-19, with 173 being treated in the ICU and 473 being treated in an acute care bed. The next slide shows active cases by zip code. And when you look at this slide, the darker areas represent where there are more active cases per 100,000 people in the county. And as a comparison, the next slide shows active pediatric cases in the county, with the darker areas representing more pediatric cases in those zip codes. And finally, a slide that you're very familiar with, residents vaccinated that have initiated the vaccination, meaning they've had at least one dose, 445,744, representing 47.6% of the population, and residents that have completed their vaccination series, 352,699, representing 37.6% of the population. So with that, the other reminder that I would like to give and reiterate is that it is very important to make sure that if you are eligible to be vaccinated, if you are 12 years of age or up and you are eligible, you should get vaccinated as soon as possible. Greater than 98% of the cases that we are seeing in the county right now are from the Delta variant of COVID-19, and most of the people who are hospitalized with COVID-19 currently are unvaccinated people. The other reminder is that a mask mandate countywide will go into effect for indoor establishments tomorrow at 7 a.m. And with that, I will start off answering the questions.
Yes, good afternoon, everybody. Dr. Taylor, you may be the best person to answer this, I'm not sure, but I am curious if the hospital systems have received an update on their request for help from the Tennessee National Guard, and then I'll have a follow-up.
That's a great question. I'm going to let Chief McGowen field that one.
Thank you for that, Michaela. We have a hospital coalition that is coordinating that assistance. I don't have the specifics for every hospital, but we do know that there are there are a limited number of individuals who can come and help. So they are putting in pretty restrictive requirements about the size of the hospital and what the demands are, also what they have done in the hospital and what limits they have. So the response will be in proportion to the utilization of the rooms, both ICU and acute care, and the size of the facility. So every system may expect to get a slightly different level of package of support. So what I can do is get a summary for you of that as to where that stands and who might expect to receive that support. But that is an active dialogue today between our hospital coalition, which is all the hospital systems, and the folks in the city and the county that coordinate those requests, and the state of Tennessee. So I don't have a specific answer, but know that that is an active dialogue, and that is something that we are working on with the hospitals and the state, even as we speak.
Great, thank you, Doug. My follow-up is definitely for Dr. Taylor. And I just simply want to know if the health department at this current point in time is considering additional mitigation steps like limiting crowd size, capacity restrictions in restaurants, and anything of the sort.
Another great question. Nothing is off the table, but for now, what we want to do is just make sure everyone is masked up. We've had a great response to the announcement. We're looking forward to the countywide mask mandate going into effect tomorrow. Our businesses are excited because they know that if they can get their patrons to mask up, they'll have a better chance of staying open. And our schools have been excited because they know that if we keep everyone masked up, we can continue to have children having in-person learning, which I think everybody can get behind. So no, we are not moving to limit capacity or limit crowd size currently, but I would say this: make sure that if you are going to be in a large crowd size outside, Shelby County Health Department would still recommend that you mask up and socially distance as much as possible. That is a high recommendation. It works. We know that if everyone masks up in the county, we can see a slowing in our transmission rate within 5 to 7 days. That's very significant. It's going to give our hospitals some breathing room, and it's also going to make sure that we're protecting people here in the county, across the county.
Brad Broders, Local 24.
Hi, good afternoon to you all both. First question is for Chief McGowen. I know you read the letter about the potential of triaging care. Could you just reiterate, hammer home to the public, those who may not be taking this seriously, who may not believe in COVID or whatnot, but what's at risk potentially for stroke, car accidents, et cetera? If you could just kind of read that a little bit for me.
So I think you really nailed it there, Brad, and that is that the more unnecessary visits to the ER, the more people that occupy beds in our acute care setting, in our ICU setting, that are there simply for having COVID, the less capacity we have to treat people who are in urgent need of treatment for a stroke, for a heart attack, for a car accident. And when they say they're going to have to triage care, that really means they're making an assessment about who is the most important person. And they do this on a regular basis, but I think what you heard them say in very abbreviated form that resonates with me is they're making life and death decisions when you're walking in the door about your probability of survival. And obviously they do on a daily basis provide medical treatment to save life of every person that comes in. But when the volume gets so high, you have to make a determination about where your efforts are best placed. So this is something that is very urgent. It has been explained to me by the medical professionals that this is a place that we do not want to be. But if you think about it, there is just a limited capacity to serve. There are only so many nurses and doctors and respiratory techs and all of the other associated people to care for patients. And when you run out of that capacity, you're left with very few other options. And so I think you're right to say that people who have non-COVID related injuries are being put at risk by the number of people that are being treated for the disease in the hospitals, especially when it is preventable.
Thanks, Doug. And as a follow-up, if my math is right, I think we went up about 100 or so total patients since last week. I'm not entirely sure if that's a record. I can go back and look, the 600, and I can't remember the exact. But based on where we're going and the potential six-fold increase by the end of September, I know the commercial appeal site closed. What's some maybe, I know you all are thinking worst-case scenarios down the line. What is potentially on the table if we get to that worst-case scenario?
So, as we've talked about when we reached the earlier peak, the ACS site was put into place and had physical capacity, but we still didn't have staffing necessarily at the ready to man that. Fortunately, we did not need that. Today, our strategy is to maximize the physical space that we have in the confines of our hospitals. And to be clear, there is additional physical space in our hospitals. There is just not sufficient staff under normal staffing ratios to get there. And again, I am not an expert as a hospitalist or anything, obviously, here, but just giving you the layperson's view. So what hospitals are doing, what the community is doing, are they are providing resources to extend care. So when you have a medical professional, a nurse, or a doctor who typically has a few patients that they are seeing on the floor, I know nursing ratios vary depending on the ICU or the floor. It can be 2 to 1 in the ICU, 7 or 8 to 1 on the floor. Providing additional resources for those individuals as care extenders, which gives them the capacity to take on just a few more patients. People that can take care of the administrative needs, the personal care, the documentation, just someone who can sit and check vitals and monitor various vital signs. That gives that person a bit more capacity. So that's one way in which we're doing it. The National Guard request is another, actually providing physical staff that comes in. As we did with the previous peak and with vaccinations, our institutions of higher learning are responding. They have, I think, approaching 400 individuals who have volunteered their time to come in. They have varying levels of medical expertise, but they are pretty well suited to come in and provide that kind of additional support for our medical professionals in the hospital to extend their capacity to care for more people. So that's really what it is. There are elective surgeries, and I use kind of air quotes around elective because if you're a cancer patient waiting for your surgery, to you that's not elective. May not be urgent today, but they are reducing the number of elective surgeries and scheduling those when they have capacity to do them and providing those staff again to provide more capacity in the hospital. So that is the strategy. Our hospitals are working very hard. Our medical staffs are working very hard. And we are corralling resources from across the community to fall in on top of our hospitals to provide them that capacity to care for people in Memphis and Shelby County and this entire region.
Stacy Jacobson, WREG.
Hello, can you hear me?
Yes.
Yes.
Okay, thank you for taking my question. I wanted to circle back a little bit to the large events. In the letter that was sent from the hospital heads, they said that they're concerned that without a masking mandate in place, which we know we're putting in, but they said as well as a reduction in capacity at large events and an emphasis on social distancing, thousands may be unable to receive prompt care. So are there any considerations to add any more of those measures to large events coming up, since there are several?
I'll let Dr. Taylor talk. I think she addressed whether or if she would address the physical capacity, but I think we're asking people to do the right thing. There are a number of venues, a number of activities, and people know at this point what to do. As an individual, you should also know what to do and when to be in a large group. But Dr. Taylor, anything else to offer on that?
As I talked about earlier, nothing is off the table, but for right now, like Chief McGowen said, we really are asking people to do the right thing. We understand that people want to get together, they want to gather, they want to enjoy events, but we're also asking people to be smart about it. And that means taking the personal responsibility and the group responsibility to stay socially distanced as much as possible, to keep your mask on, even in outdoor settings when you know you're going to be in a large crowd, and to just be smart about it. We know that our hospitals are under strain, and so that should give people even more motivation if they are choosing to gather, to do the right thing, to put on their masks, and to make sure that they are distancing as much as possible.
So to be clear, with large events like the Delta Fair as well as the Southern Heritage Classic coming up in the next few weeks, do you think those events should move forward?
Well, that is up to the promoters and the folks who are doing the events to decide if they should move forward. We have given recommendations, and we will give formal recommendations within our amended health directive. But for right now, we are doing a countywide mask mandate, for indoor establishments, and highly encouraging that if you are going to be in crowded spaces outdoors, that you have your mask on and that you socially distance as much as possible.
Dominique Dillon, Fox 13.
Good afternoon. This question is for Dr. Taylor. Are you concerned the governor or state leaders may undermine your countywide mask mandate, halting your progress moving forward?
My concern at this point is for the health of Shelby County. So everyone who lives here is the concern of the Shelby County Health Department. Anything that's happening in Nashville is what they are doing up there. Right here in Shelby County, we are making sure that everyone stays as safe as possible and that we get the information out that COVID-19 is real, that folks need to get vaccinated if they have not done so and they are eligible, and that they need to be wearing their mask as much as possible, and they will be required to wear masks in indoor spaces, and we are highly encouraging that they wear masks in outdoor spaces when they are in crowded places that they cannot socially distance at 6 feet. And we're also recommending that people socially distance as much as possible outdoors.
And as a follow-up, do you have a message to surrounding counties that these hospitals have reached out to, asking them to follow your lead as far as reinstating a mask mandate?
My message to them is that we have always been partners. We live in what most people would call a tri-state area. And so everything that happens across our borders also happens here. And so my recommendation to them would be to look at the rates that are going on in their states, their counties, their localities, and really consider the health of your residents. When we make decisions in Shelby County, we're also considering those residents too, because we know we're in this together.
Kelly Roberts, WMC.
Hello, and I'm sorry if you may have to be repeating yourself, but I know that we got the hospitalization numbers. Can you put it into context? Are we at the peak of this pandemic? Have we surpassed the highest that we saw during that winter surge or post-holiday surge?
So that's a great question. I don't have all of those numbers, but what I can tell you is that it's difficult to know whether we're at the peak. That's why we made the move that we did to institute a countywide mask mandate. What we do know is this: our hospital system is strained. We have a higher, what we call acuity or number of patients than the hospitals would normally be seeing, especially during this time of the year. As a pediatrician, I can tell you that some of the conditions, respiratory conditions, in addition to COVID, that our pediatricians, our family practitioners, our nurse practitioners, and everybody else in the community that are seeing in kids, normally they wouldn't see these levels until the winter time. And so it's really important to remember, it's not so much about the peak, it's about the capacity to be able to care for folks who need to be seen. And so I know everybody is watching the numbers, and you should, but you should also keep in mind the capacity to take care of people who are sick. If you break your toe, if you have a heart attack, if you have a stroke, if you have a problem with your diabetes levels, all of those things figure in when you show up to the hospital, and we have our emergency department directors telling people, listen, waits in the emergency department are 36 to 48 hours. I've heard reports as high as 60 hours. That's almost 3 days waiting to just be seen. The hospitals need us to work with them to be able to continue to function.
And just finally, I'm wondering if you guys can talk, when you look at the graphs of hospitalizations, usually what we've seen is a gradual incline, but the graphs really show kind of how fast this Delta variant really does transmit. So is that one of the factors that didn't play into earlier in this pandemic when we were seeing such high hospitalizations? And with these high hospitalizations, is this, another just curveball really that's being thrown at the hospitals that they, have to get around just how quickly people are getting this virus?
Well, I think, that's a great question. I think the main thing to remember here is this. In comparison to what we saw earlier in the pandemic, now what we're seeing is a surge essentially of the unvaccinated. So what that means is that, like I shared with the commission yesterday, we are seeing people who are younger, they are sicker, they are requiring more resources and more time at the hospital. And when you see that, you realize that a lot of this surge could have been prevented if we had been able to get more people, convince more people to get vaccinated. But that's not where we are. So right now where we are is trying to convince more people, particularly in those younger age groups where we're seeing a lot of people who are still not getting vaccinated, to convince them COVID-19 Delta variant is real. It is getting younger people sick. It is getting kids sick. And with the start of school and a lot of people returning to in-person work and returning to in-person life, it is really important that if you are eligible to be vaccinated, 12 years of age and up, that you do so. Because right now in the hospital, we have a lot of people 20 to 40 years old, and I'm being very broad there, but this is the case, 20 to 40 years old who are in the hospital and don't have to be there, didn't have to be there if they had decided to get vaccinated. And then we have a lot of children in the hospital who, if the adults that they live with and the adults that they're around had decided to get vaccinated, they would have had a less chance of being in the hospital with COVID-19. So the message is simple. If you have not been vaccinated and you are eligible, or if you have a child who has not been vaccinated and they are eligible, meaning they are 12 years of age and up, now is the time to go and get a COVID-19 vaccination. There's no more time to waste. There's no more time to waste. The vaccine is safe, it's effective. We know that most of the people who are hospitalized right now with COVID are unvaccinated people. And so even if you have what we call a breakthrough case, you will still avoid, more than likely, the hospital if you are vaccinated.
We are out of time today. Are there any other closing messages?
I will continue to say, and I know Chief McGowen will agree with me, please get vaccinated if you are eligible. Be prepared to have your mask on in all indoor establishments starting tomorrow at 7 a.m. And if you're going to be in crowded outdoor spaces, then be prepared to have your mask on and socially distance as much as possible.
Thanks, everyone. We'll see you back here next week.